So, what does intensive intervention using the DBI process look like in practice? The process begins with a team of educators trained in the DBI process who meet regularly to review individual student data. Here is one elementary school's intervention team. It is important to note that schools may have multiple teams or schedule meetings to look at different types of data, such as school level data or grade level data. When talking about the DBI process, the team is focused on the needs of individual students and will incorporate educators, specialists, related service providers that work with the student or students being discussed. This may include both general and special education or related services as appropriate. As part of this team's agenda, we will be looking at a student named
Jackson is struggling in math. He is a third grade student, and during the fall benchmark screening, he was identified as being at risk for poor math outcomes using a curriculum-based measure, also known as CBM. After confirming his risk status using additional data, it was determined that Jackson would benefit from additional intervention. Using initial data of Jackson's math performance, the team identifies a small group standard protocol Tier 2 intervention that includes explicit instruction in the additive operation, which is both addition and subtraction, and how to solve problems with a combination of words and numbers, word problems. Based on the publisher's recommendations and the research that confirms the evidence base and effectiveness, the intervention will be delivered with 2 other students with similar needs for 30 minutes 3 times a week per week over the course of 15 weeks. The team creates a plan that includes the intervention, who is responsible for delivery, a timeline for reviewing progress monitoring data, and a clearly defined goal, as well as a method for progress monitoring. The team plans to reconvene every 4 weeks at their scheduled monthly DBI team meetings. At that time, they will review the progress monitoring data and determine if the student's response to intervention is adequate. The goal is set at 40 points correct within 12 minutes for concepts and applications, and the decision rules is identified as 4 data points above or below the goal line. Jackson's teacher uses the database individualization implementation log to record fidelity of implementation data, as well as the level of student engagement. The team will use a concepts and application curriculum-based measure to monitor Jackson's response to intervention. Jackson will solve as many problems as he can in 12 minutes. Once complete, the teacher using the scoring guide to record the number of correct problems, and then calculates the corresponding number of points based on Jackson's response. Jackson's baseline score was 16 points correct. The team plots the baseline data at 16 points correct and records weekly progress monitoring until the next review period. At the next month's team meeting, the team reviews the data. After 4 weeks, the team reconvenes and reviews Jackson's progress monitoring data. The team reviews the fidelity data and determines that the intervention was delivered with fidelity, and the team confirms that most students who received the intervention were responsive. The team then compares Jackson's progress monitoring data to the goal line set at the beginning of the intervention. Did Jackson respond adequately? Which means he is on track to meet his goal, or is he not responding to the intervention? While many students respond to the validated intervention program, in some cases we get mixed or poor results. This new scenario here will illustrate how the team reacts if Jackson does not respond to the intervention. In this case, before reviewing individual student data, the team reviews the fidelity data and determines the intervention was delivered with fidelity and confirms that most students who received the intervention were responsive. The team then compares Jackson's current performance to his expected performance and goal line to determine that he is not responding to the intervention. All of his data points are below the goal line, indicating he is not on track to meet his end of intervention goal of 40 points correct. Due to the non-response, the team begins to collect information on Jackson's intervention, his performance, and engagement to develop an initial hypothesis. From there, the team plans an adapted intervention to further support Jackson's responsiveness. This adaptation is outlined in Jackson's individual student intervention plan, and as they have for previous interventions, the team continues to collect and review progress monitoring data to monitor whether Jackson has responded to the intervention adaptation or the adapted intervention, or if additional data analysis and adaptations are necessary. Upon reviewing the data sources, the team determines that with the changes in place for Jackson's intervention, he has begun to make progress in using additive schemas when he solves word problems in the intervention block. However, this does not seem to transfer to his work on the grade level assessment or the regular classroom work where they are working on multiplication problems. The team decides that he needs support in transferring his knowledge to various settings. So they are going to work to share the strategies of schema-based instruction and the posters of the problem type prompts to his classroom teacher to see if the procedures can be matched to the core instruction, providing additional opportunities for Jackson to hear the same language and apply the same knowledge in different settings. Because the team decides that Jackson is struggling to transfer this new knowledge outside of the intervention context, they decide to embed the schema-based instruction strategies and problem type poster prompts to Jackson's core instruction. The team modifies the plan and changes the additional resources and support needed. With the increased support from the core classroom, Jackson will have additional opportunities to practice the same techniques outside of intervention, apply to new settings, and hopefully generalize the information learned in intervention to other settings. Once the intervention adaptation has been determined, the next step is to continue progress monitoring. The team collects progress monitoring data for an additional 4 weeks and reconvenes to analyze the data to determine whether Jackson has responded to the adapted intervention. The team meets after these additional 4 weeks to determine whether Jackson has responded, and the team compares his current performance to his goal line established at the beginning of the intervention. Is the adapted intervention working? For students with severe and persistent learning needs, the DBI process serves as an ongoing cycle of data analysis and adaptation. If Jackson did not respond as expected to the additional adaptations, the team would return to the previous steps in the DBI process, conduct additional diagnostic assessments to further refine and individualize the intervention for Jackson. This continuous process will ensure that Jackson's unique learning needs are being addressed.